One tick bite can make meat turn against you. It starts in ordinary places, a yard, a trail, a dog run, where a parasite waits with its front legs raised. Most tick bites are remembered for itching or worry about infection, but this one can leave a stranger souvenir inside your immune system. Across much of the eastern and southern United States, the Lone Star tick is drawing attention because patients keep arriving with the same strange pattern. The risk is not that meat becomes poisonous. It is that your body can begin treating a normal meal like an intruder. The key is not a venom, and not a germ in the usual sense, but a sugar molecule called alpha-gal. Alpha-gal is short for galactose alpha-1,3-galactose, a carbohydrate found in most mammals, but not naturally on human cells. Cows have it, pigs have it, sheep have it, deer have it, and traces can appear in gelatin or some dairy foods. When a tick feeds, its saliva is a chemical toolkit, quieting pain, controlling clotting, and changing how local immune cells read danger. In some people, that bite appears to teach the immune system that alpha-gal is not food chemistry, but a threat. You might never see the tick, or you might brush it away and remember only a red bump that itched too long. Behind that small mark, your body may build IgA antibodies, the same class involved in many fast, dramatic allergies. If this kind of biological trap keeps you watching, the subscribe button is right there while we follow the evidence deeper. Days or weeks later, you eat beef, pork, lamb, or venison, and nothing obvious happens while everyone is still at the table. Then, 3 to 6 hours later, the mystery begins, often after midnight, when dinner should be over and forgotten. Hives can bloom across your skin. Your lips can swell, your stomach can cramp, or your chest can feel suddenly tight. The delay is the clue, because alpha-gal seems to ride into the bloodstream with fats that take time to digest and package. When those particles finally circulate, alpha-gal can cross-link IgA on mast cells, pulling the alarm handle hours after the meal. Those cells dump histamine and other signals, opening blood vessels, irritating nerves, tightening airways, and turning digestion into a warning siren. In severe cases, blood pressure can fall and breathing can become dangerous, which is why unexplained nighttime reactions deserve medical attention. The connection is easy to miss because most food allergies strike within minutes, not after the dishes are washed and the house is quiet. So the bite, the burger, and the rash live in separate memories until the same sequence happens again. Some people react every time, others only sometimes because dose, digestion, alcohol, exercise, and anti-inflammatory medicines can change the threshold. That variability makes alpha-gal syndrome feel like a ghost diagnosis, appearing after one dinner, hiding after another, then returning with force. The Lone Star tick gets its name from the adult female's pale spot, but the important part is its aggressive search for hosts. Deer, small mammals, pets, and people can all become moving meals, helping ticks survive at the edges of neighborhoods and forests. Warmer seasons, shifting land use, abundant deer, and better surveillance may all be pushing this tick, or our awareness of it, outward. Doctors do not need a tick in a jar to suspect the pattern, but a history of bites can sharpen the question. A blood test can look for IgA to alpha-gal, then the result has to be matched with what actually happens after meals. A careful food and symptom diary can reveal the hidden rhythm, especially reactions that wake you after red meat or mammal-derived ingredients. For some patients, avoidance is straightforward. For others, gelatin, high-fat dairy, broths, or medical product can complicate the map. Prevention sounds mundane, but it matters. Treated clothing, repellent, staying out of brush, shower checks, and careful pet protection reduce bites. If a tick is attached, remove it close to the skin with fine tweezers and avoid crushing the body into the wound. Anyone with breathing trouble, throat swelling, faintness, or widespread hives after eating should treat it as urgent and ask about allergy evaluation. The strangest part is that the meal is innocent, the immune system is earnest, and the clock is what hides the crime. Once you know alpha-gal, the mystery rearranges itself. The tick did not spoil the meat, it changed the reader. The hidden clue is not where you ate, but when you reacted and whether mammal meat keeps appearing before the alarm. That is why people can go months blaming stress, shellfish, spices, or bad luck before one careful question points back to ticks. A creature smaller than a seed can leave an instruction set your immune system obeys long after the bite disappears. So if meat turns mysterious hours later, remember the sugar, the clock, and the bite. Subscribe for next week's Strange Biology.